Dr. John Liang is Assistant Professor of Neurosurgery and Neurology in the Icahn School of Medicine at Mount Sinai. He is a neurointensivist at Mount Sinai West and is also Director of the Tele-Neurocritical Care Program for our Division of Neurointensive Care. Dr. Liang received his bachelor's degree from Stony Brook University, where he majored in neuroscience and used to play in basketball tournaments. He received his medical degree from Ross University and his residency and a fellowship in vascular neurology at Mount Sinai. He also completed a fellowship in neurocritical care at Jefferson Hospital for Neuroscience. He and his wife Cecily have an 8-month-old son, Aiden. Cecily has been helping Dr. Liang gather PPE donations from the Chinese community because she can read and write in Chinese.
What is your usual role within Mount Sinai? What have you been assigned to do during the COVID-19 crisis?
I'm one of the neurointensivists at Mount Sinai West, and my typical role here is really managing neurocritical care patients and predominantly patients with intracerebral hemorrhage, which is what our unit is known for. But since the COVID has started, we kind of shifted our department a little bit and reorganized our structure. And we have preferentially transferred all of our typical neurosurgical volume to our sister unit, and that kind of opens up our entire neuro ICU here to participate in the coronavirus efforts here at Mount Sinai West.
Can you describe what your new day-to-day life is like? How many days and hours are you working each week?
It's a little tricky. It's a different patient population than what our nurses, our NPs and PAs are typically accustomed to in the neuro ICU. So there was an upfront education piece just to train our staff to understand, this is what we're looking for. It's a bit of a change in mindset based on how we typically manage neurology patients in terms of the medications we use, the high amounts of sedation and paralytics that we're using for these patients to adjust the ventilators. So that was one of the big upfront battles and challenges, is just to get everyone comfortable with a different patient population. But I think everyone caught on really quickly, and it's been a very good experience. We typically here at Mount Sinai West, me and my other intensivists, we kind of alternate weeks. So I'm on 1 week, 24/7. I round in person during the day, and then I'm available by phone at night for the entire week. And then Dr. Patel, he switches off and he takes over the following week. And then on my off week, sort of speak, I kind of just floated around wherever I can be useful. So sometimes I go to the other ICU at Mount Sinai Hospital. Sometimes I'm just helping coordinate donations and things like that.
What's it like in your unit now? Can you describe the environment?
I think it's really hard to, it's very hard for everyone, right? It's hard for the providers, it's very hard for the patients and the family members, and there are things that, unlike most of people who get critically ill, they either, you saw it coming, they were probably sick for months, for years, and then they get really sick, or, they're have high blood pressure, diabetes, and then they have a stroke or active smoker, things like that. Here you have someone that's like my age and they're perfectly healthy. They go jogging, and then now they're in the hospital. They're on oxygen, and it's really hard to actually talk to these patients to talk about goals of care and what do you want to do if you can't breathe, if your heart stops. It's not something that you would normally talk about. to a 30-year-old who was, jogging yesterday, right? And then it just gets a little hard also for the family members. You see on the news, every day the death toll is going up. What you see on the news is definitely very, very hard to deal with, and they can't see their family. And for those people who are intubated, they can't talk to them on the phone. They have no idea. It's kind of like a black box. So I think one of the things that our department has come up with, which I think really worked out very nicely, is we have dedicated people who are not in the active clinical management role, but they ran with us, and they stand with us by round. They hear all the plans, and then afterwards they break off and they call families and give them a update. So at the very least, family members are getting a daily update to know what's going on. Because I definitely have friends who have their loved ones admitted to a different hospital, and they've been trying to get updates for the last 3 or 4 days, and they still don't know what's going on. So I think that's a really tough situation. So I think we just got to remember that everyone's going to do a lot, and just have that in mind and try and keep everyone informed.
What's the feeling among staff?
I think it's definitely kind of changed. I think when it first started, understandably everyone was afraid, right? Because we are doctors and nurses and what have you, and yes, we signed up for the job. We knew we were here to do what we gotta do. But then all of us have family and kids at home. So then it's like, where's your responsibility lie, right? Is it, to your patients, or is it to your own family member? So I think in the very beginning, everyone, there was, you could tell there was a lot of silence, and everyone was just nervous about the unknown, right? You don't know what this is, and all you see is people your age getting intubated, right? But I think once you get over that fear, you kind of learn to live with it. I think you kind of start saying, this is what we gotta do, and then we'll just get it done, and hopefully this is gonna be another one in history books, and then something to talk about in the future, right? I think right now the morale is getting better. Everyone's actually more, it's actually nice to see that people are actually banding together. Right before I came, I was just met with some of our physical therapy colleagues, and they're like, what, you use us, right? We can come and we can help you move patients. We can help you flip patients around. We can do whatever, right? Just use us. We're here. We're ready to help. Our chief resident, he's offering to help, just manual labor. It's like, I will help you get patients out of bed. Just use me, right? So it's nice where for the first time you kind of, there's no longer like a distinction between this is medical ICU, this surgical ICU, this neuro ICU, right? We're just one big ICU, right? There's no specialists or subspecialists, right? We're all just one big team. So it's really nice to have people. You have ophthalmology, you have dermatology come into the neuro ICU and helping out. So it's always a nice thing to see.
How has your role in the neurosurgery department prepared you for this new role?
Yeah, I mean, it is a blessing. I did a critical care fellowship, so we were all trained in critical care management of ARDS and ventilators and of that sort. So that does make it easier for the transition, as opposed to, like you were mentioning, some of our neurosurgical colleagues who really stepped up and were learning about vents and everything for the first time, or not the first time, but just getting more and more accustomed to it, right? I think all of us, because it's so new and there's really not much evidence or not much data out there to read, I think all the intensivists that are treating this disease are basically turning to our societies, like Society of Critical Care Medicine, and reading all the guidelines. There's been a few papers that come out from the China Wuhan experience and Italy, basically, wherever the virus starts, and then when that country gets more and more data, they put out papers, and we kind of build on that experience. And then we kind of also talk amongst ourselves in New York and Sinai, and try and figure out, share experiences, and we kind of take things as it comes, and we kind of change our management even from day one to now. I think our management styles has definitely made a few changes based on what we noticed.
Have you had any interactions with patients or their families you'd like to share?
One of the things we also had, now that we have, we bought a bunch of iPads, so I think that also worked out very well. I had people who were able to join in on a Zoom meeting and say goodbye, or at least it was a nice thing where they were at least able to say a few words before the end. And I think people really appreciated that. It was a little hard to watch, honestly, just holding the iPad for them to say goodbye. But I think we just gotta take it as it is.
The coronavirus is scary. Everyone has a certain level of fear about what might happen to them if they get sick. How are you feeling? How have these feelings influenced your work?
I think you're kind of just so busy that you don't really have time to sit down and kind of reflect about what's going on. You just kind of, feel like, work, sleep. I think it's not so much. I think it's always more that you're gonna bring it to like your loved ones, right? I don't want to give it to my parents. I have a 7-month-old son. I don't want to give it to him. So I think that's what everyone's main concern is not to pass it on to someone that's more vulnerable. So we kind of I kind of have this routine. I go home and I take everything off and throw everything into the washer. I've been kind of isolating myself, so I don't stay in the same place as my son and my wife, so I kind of separate myself. So it's definitely it's hard, right? Especially when you have a new baby who's starting to starting to do all these fun stuff, and all you can do is watch it on FaceTime. So it's rough. I think we all talk. One of the fun thing is I hear a lot of my colleagues say, I'm being deployed to here, I'm being deployed to there, and then usually when you talk about deployment, you're thinking about like the armed forces or whatever, and like I would never be able to do what the armed forces do, but now I'm like, I'm like watching family on FaceTime, and it kind of gives you a different perspective on what everyone is talking about.
What has impacted you the most emotionally?
Being away from the family, and also just witnessing all the end of life discussions between patients and their family members. I think that's probably the absolute hardest, is being in the room holding the iPad and watching kids and grandchildren say goodbye. And I think that's the hardest part, to just it's honor to actually be there to listen to some of these amazing stories that they tell each other. And I had a very sick lady yesterday who was made comfort care, and she saw her 16-year-old grandchildren, they were saying, and then she was smiling. So it was a great thing to witness. Absolutely. And you just gotta take the time out to give people that chance to say goodbye.
Are you doing anything outside of work to help you power through this? How about sleep, exercise, reading, meditation, cooking, touching base with your family and friends? What are you doing at home to help you make it through the day?
Unfortunately, haven't really had much downtime. It's been really mostly work, and then when not working, kind of trying to just catch up with what's being published so that when you come back to work, you know what you're dealing with. And then on the 1 or 2 days where you're really not doing anything, you're probably online trying to get some groceries, or you have food on the table. So and waiting for groceries, that takes a long time nowadays. So I think most of the time is just standing on the online to get groceries, as I'm sure everyone else is.
What would you like other people to know about what you are experiencing and what we are experiencing taking care of this crisis?
I think, we could have been a little better prepared as a country, but I think New York has really done a remarkable job. All the leaders in in government and hospital within New York, they've really stepped up and done whatever was needed to make sure everyone was safe. Unfortunately, the volume just exploded all of a sudden, and the amount of people, you see all this PPE shortages, which if you don't have it, you can't get it instantaneously, right? So I think everyone's doing the best that they can. But I think at the end of this, we really do need to recognize that there's all the sacrifices that everyone on the front lines are doing. And one of our main concerns is now that we've heard that maybe the curve is flattening, that everyone just kind of relaxes too much and starts going to the beach and having barbecues, and then we're right back to the same starting point. So I think that's the main concern that I would have, is just don't relax too quickly.
Do you think your life will change in long-term ways because of this crisis? How do you think healthcare is going to change?
I don't know. I would hope so. I think there's been a lot of discussion on all these community chat groups on Facebook groups and what have you, about there are hospitals that are slashing pay for physicians and nurses, in the light of losing revenue, and they're talking about slashing pay for everyone, which seems a little, it just doesn't sit quite right, for people who are in their sacrificing everything to come back, and after a few months realize that they're getting paid less because for whatever reason. I wonder, maybe there might be some legislature coming up to kind of protect people's rights in terms of protection and PPE, by going to front lines and just insurance coverages and making sure everyone's protected if anything happens to them.
Every crisis has a silver lining. Tell me what some of the silver linings for you are in this crisis.
Yeah, no, I think it's one of the things that this COVID, if there's a silver lining to it all, is that you see, especially nowadays where there's so much divide out there, it's like it's all politics, what all that stuff that no one wants to talk about. But it's nice that you actually see people who are actually banding together to just it's really a time for people to shine and to show what they're all about. And not even people in the hospital, just anyone out in the community, like we were talking about before, all the donations that were coming in. I had a neighbor come over, she was like probably 80, 90 years old. She was like, I have, a box of N95. I'll just take one and you can have 9. I'm like, no, you please hold on to it. So, it's nice to see that, there are people that are selfless out there and willing to pitch in.
When the worst part of this crisis is over, what's one of the first things you want to do?
I'm very simple. I just want to go watch a movie, like that's all I want. I just want to go watch, something relaxing, I'll go watch a Marvel movie or whatever, and just relax. Yeah, no, I think, after all this, there are little, silver linings everywhere. You definitely do get a new appreciation for what's really important to you and what's what you could live without, right?